As a federal employee, I have to start out by saying the views and opinions I express do not represent those of the United States government or the Centers for Medicare and Medicaid Services. All right, I'm glad we got that out of the way. How many of you are getting what you need out of the healthcare system? Okay, I'm not seeing too many hands out there. So the problem is healthcare has become so complex that patients aren't getting their needs met. And doctors feel like the joy of practicing medicine is slipping away. Despite being slow to change, the healthcare industry is finally starting to transform right now. About 2 years ago, I was invited to help lead a healthcare improvement project. Doctors, nurses, physician assistants, nurse practitioners, social workers, chiropractors, and many other clinicians were invited to participate. Over 100,000 clinicians signed up. They come from 23,000 medical practices from across the country. This federal program is called the Transforming Clinical Practice Initiative. Over 4 years, the project hopes to improve the health of millions of Americans, prevent 5 million hospitalizations, avoid unnecessary medical testing, and value doctors based on the quality of care they deliver instead of the sheer number of patients they see or surgeries they perform. The project seeks to nourish the patient-clinician relationship and put the patient in the center of the team. Are you all ready for that? Yes. If anyone would have been able to navigate the healthcare system, it would have been my friend, Susan. She was a healthcare consultant with over 40 years of experience. For a living, she would give advice to hospital CEOs. One day last year, Susan called to tell me she was diagnosed with a rare form of cancer. She worried, would she be able to make decisions as her condition progressed? She wanted her family members involved with decision-making. Would her medical team listen to her? I remember one day Susan showed up at the annual medical conference focused on her type of cancer. She went around to all the medical experts from around the world and asked for their opinion on her case. After months of research, she probably knew more than anyone else about treatment options, prognosis, and research. 3 months ago, Susan lost her battle. Her friends and family lost a strong, loving woman. The healthcare industry lost a brilliant mind who dedicated her life to helping hospitals improve. Even with her 40 years of expertise, Susan was not spared from frustration, miscommunication, and a feeling of powerlessness once she became a patient. And not only patients are suffering, but doctors are struggling too. Over half of physicians have at least one symptom of burnout, and over 40% of nurses are burned out. For my own medical school class, classmates are seeking an exit strategy after just 15 years of practice. One friend's going into real estate, another one is winding down her practice, and a third joined pharmaceuticals. Doctors are spending nights and weekends typing notes into the computer because they can't finish their notes during the daytime. How many of you have been to the doctor only to see the doctor's back while typing? For doctors, Saturday date night is a date with the computer instead of their spouse. And pajama time means the doctor is sitting at home in pajamas, typing notes, instead of tucking kids into bed. Practices are working right now to redesign in order to achieve work-life balance. A married couple of family physicians in the Midwest advocates that their patients lead an active lifestyle, and they practice what they preach. In the winter, they cross-country ski, and in the summer, they're avid bikers. This couple reasoned that when their patients get sick and end up in the hospital, they decided to carve out time out of their busy clinic schedule and go visit their own patients. This is increasingly rare because typically hospital-based doctors make inpatient rounds. This couple decided that they wanted to be there for their patients when they needed them most, and they enjoy a great work-life balance. When practices make innovations, it's not only the doctors that benefit, but the patients benefit as well. Out west, a kidney specialist is getting the best outcomes for his patients with chronic kidney disease. His patients need dialysis treatments 3 times a week. If they miss just one treatment, they can get very sick and end up in the hospital. This physician and his team use care coordinators to ensure his patients never miss a treatment. They also use pharmacists to ensure the patients are taking the right medications. And they deploy mobile medical units to visit the patients in their homes to solve problems early before they become serious. This type of proactive approach is new to healthcare, and it helps keep patients out of the hospital. Practices are also pulling patient data out of the electronic medical record. A physician down south is tackling his patient's hypertension. Across the country, high blood pressure is controlled only 50% of the time. This physician and his practice team looked at their patient data and discovered which patients were under good control and which patients need more help. With regular phone calls, they reminded their patients to take their medicine and get their blood pressure checked. This work is so important because high blood pressure can lead to heart attacks and strokes. The practice achieved a 90% control of blood pressure. They were very proud of what they accomplished, which was saving their patients' lives. But doctors and nurses can't do it alone. In order to generate great results, practices need to partner with activated patients. Activated patients are empowered to take control of their health care. They use shared decision-making. They communicate with their medical teams which outcomes are important to them. Do we have any activated patients in our audience today? Do we have any activated patients in our audience today? All right. In Florida, a pediatric practice is listening to patient feedback to improve their care. Their patients report they go to the emergency room at night because the practice is closed. This pediatrician and his practice team redesigned the practice so they could stay open until 9 o'clock each night. This means the patients no longer have to go to the emergency room for non-emergent issues, and they don't have to miss school or work, and they get to see the doctor they want to see, their own pediatrician. Across the country, the opioid crisis continues, and we're hearing about the best techniques on how to try and manage it. In the Midwest, an emergency medicine physician was describing how hard hit his community has been. He partnered with 3 other emergency rooms in the area to ensure patients are treated with compassion and the overprescribing of opioids was not exacerbated. And in rural West Virginia, a family medicine physician is tackling the opioid crisis head-on. She has her doctors measure how much opioids they prescribe, and she has contracts with all her patients to monitor opioid levels. This gets the doctors and the patients on the same page. In the 3 years since her program started, there's been an 85% reduction in opioid prescribing and 0 deaths from opioid overuse for those in her program. If you talk to any patient or any doctor, you can hear about the problems with our healthcare system. But change is happening right now. We have over 100,000 clinicians working on transformation. In the future, the practice will feature patients partnered with their medical teams. The tools they will use include data analytics, population health, and patient activation. Since joining this large-scale healthcare quality improvement project, patients have taught me the value of shared decision-making. Clinicians have shared their improvement stories on how to improve care and restore the joy to practicing medicine. Government leaders have taught me how to inspire a community of caregivers that will benefit millions of people. From Susan, I've learned we're all patients. And we, patients, doctors, family, loved ones, clinicians, we all need to work together to push forward transformation in healthcare. Thank you.